In today's session, we're gonna focus on developing soft skills for our future as dental students. I'm really honored to introduce you our speaker, Dr. Sompop Bencharit, adjunct professor in prosthodontics at Adams School of Dentistry. And just a quick reminder, we're gonna have after the presentation, we're gonna have Q&A. So just feel free to write down any question that you have during the session, and we will discuss it later on with the doctor. Thank you, doctor, and we are looking forward to learn from your knowledge and experience. Thank you.
Thank you, Irfan. I'm gonna share the screen
Just turn off my
and
camera.
hopefully, can you see the screen? Okay, let me do something. Let me minimize this real quick because if I minimize this, then it's hard to see. Okay, here we go. Okay, can you see my screen okay?
Yes, doctor, it's quite clear.
Yes, so thank you, Evan, and thank you, the Azerbaijan Dental Student Union that allow me to speak today. I'm connected with Evan through LinkedIn, so if you're interested, check out my LinkedIn and my Instagram on the right side of the screen. Just a little bit about myself. So I have my education and training experience in Thailand, also in 4 university in United States. On the top left is University of North Carolina, Chapel Hill. On the right side is the Virginia Commonwealth University in Richmond, Virginia. On the bottom left is a famous picture of what we call the Rainbow Row in Charleston, South Carolina. I worked there in Medical University of South Carolina in Charleston. And my last place that I work in was at High Point University, so on the bottom right. So a little bit more about myself. So I have a DDS degree and I was a prosthodontic faculty at Chulalongkorn University in Bangkok in Thailand. And actually I'm speaking from Bangkok tonight. In 1996, I went to United States and I participated in graduate prosthodontic residency training. And then I did my PhD in oral biology. I was a postdoc for a little while and I taught there in the prosthodontic department and also in the pharmacology department for 11 years. I am a board certified prosthodontist. And then in 2016, I have moved to Virginia Commonwealth University, or VCU, to start their digital dentistry program. And then I was the dean, assistant dean for innovation, and the founding chair of reconstructive rehabilitation science in South Carolina. And my last place that I has been was at High Point University. I was their founding dean for innovation and chief innovation officer. So today we will talk very little about dentistry, but I want to introduce you what we call soft skill in dental education. And the soft skill in the dental education, we just going to go to what we're going to talk about tonight is what are soft skill and what are soft skill that are essential in dentistry. We will touch a little bit on research on this topic. Unfortunately, we don't have a whole lot of research in this area. And how or what should we teach these skills in the dental curricula? We will focus a little bit on burnouts and how to manage burnout and how to prevent burnout in the student and faculty population. And we're gonna end. I'm a technology person, so we're gonna end with some technology that might enhance some soft skill in dental education. So what are soft skill in dentistry? Soft skill in dentistry is our non-technical ability that help a profession to interact effectively with patient and colleagues, meaning that everything that nothing to do with dentistry, but have anything to do with everything else. So it includes communication, empathy, teamwork, critical thinking, and adaptability, and I would say everything else. It improved patient trust, treatment satisfaction, overall professional environment. So what are some essential soft skills in dentistry, right? Of course, we have as a dentist, we have to have a good communication skill. We need to learn how to have active listening. We have to have a clear verbal and nonverbal communication and have ability to explain complex procedures in an understandable way to the patient. Remember that our language are used among our profession usually are not understood well by the patient. And we have to have, as a healthcare professional, we have to have an empathy and compassion. And empathy and compassion are ability to understand and to share the feeling of a patient is crucial for building trust and reduce the patient anxiety, especially in the dental chair. We also work as a team. So as a dentist, we don't work alone. We have to have ability to collaborative effectively with other specialty, other personnel in order to organize and coordinate the patient care properly. We also have to have a good critical thinking and problem-solving skill. Each situation are different, each patient are different, each cases are different. We have to be able to analyze different situation, make sound, appropriate decision, and adapt it to the unexpected challenges during the procedure or during particular type of patients. And we have to be able to adapt to different situation, patient attitude, or certain thing. For example, the equipment malfunctions and the lost powers or computer breakdown. We also, we have limited time seeing patient. We have to do procedure in a limited time. Therefore, we have to learn how to do a. I think my voice is a little echo, so I think someone needs to turn off some. Sorry. Okay, so we have to have effective time management and effectively handle multiple tasks. And we also need to have effective professionalism, meaning that can you hear me okay?
Yes, now it's all right.
Okay. So we have to have a good professionalism, meaning like as a dentist and as a healthcare professional, we have to maintain a high level of ethical and professional value. Include, for example, you have to see the patient on time and you have to be an honest and trustworthy person. Now, our work is not without stress, right? So we have to be able to learn how to manage stress and how to maintain your composure and self-care in a stressful environment. And we're just going to touch on a few of these things tonight because, if we talked about every single thing, every single skill can have its own, it can be its own topic, and we can talk about those for days. So I'm going to touch on a few core leadership and professionalism component of the soft skill in dentistry, the core one, and something that I think that is important around it. So as a dentist, you are the leader of the oral healthcare team, right? So you want important thing about it is you have to be able to communicate clearly. And then at the same time, I think the first thing about communication is an active or deep listening skill. Of course, empathy and compassion is part of it because you have to learn how the patient feel and how to not just sympathetic with them, but empathize with their situation. And we don't work alone. We have to have teamwork and collaboration. One of the things that is important to us, and we need to put this in emphasis in all dental student or resident or fellow, is you have to have emotional intelligence and adaptability because things usually not going well and how you deal with things when they thing doesn't go well in an emotionally intelligent manner and being adaptable. So a communication skill is foundation of patient trust. And we don't just talk about how we speak, but also the posture, how you touch the patient or how you don't touch the patient in certain cultures. And how did you act? How do you look at the patients? And also, when you explain to the patient, you should use the language that not dental language that communicate clearly to the non-dental person. Don't use some jargon or some weird complex words. And also, you need to listen attentively and actively for the patient needs and concern. You want to allow the patient to express themselves, allow the patient to state their chief concern or chief complaint. So what is the emotional intelligence and how do you manage your emotion during your stressful practice? So you want to be able to recognize the patient anxiety and then remind yourself that you need to respond to the patient anxiety regarding to their condition or their suffering or their pain with compassion. And at the same time, of course, the emotional intelligence that go both way, right? So you have to be able to actively recognize the patient anxiety and respond with compassion. At the same time, we have to be able to recognize our own stress, our own anxiety, our own fear, and then use the recognition to maintain your composure. And every day to me is important to cultivate the empathy as a habit, meaning that you learn to feel what your patient may be feeling. And by put yourself into other people's shoes, you can be more empathetic practitioner. So what about teamwork, right? Teamwork and collaboration. Teamwork and collaboration, nobody work by ourselves, right? We work with dental hygienist, dental assistant, the specialist, the lab tech, the front desk, the people who deliver your materials. If you own your practice, you also work with your financial advisor or your bankers or whatever. So you need to learn to have a respectful communication and foster an effective communication with morality. And this be more challenging when you have to solve a problem that are more complex, right? Because, for example, if the patient don't have money, they have a complex oral health issue, or maybe the patient also have medical health issue. So these are things that you need to work through and learn to work as a team. Now, to me, by being a leader, you have to have a leadership skill and professionalism skill. And you need to lead with integrity and purpose because leadership is not authority, meaning that you want to inspire and influence your team versus you authorize your work. You wanted to demonstrate the high ethical behavior and respect, and you wanted to mentor others and your team and encourage a culture of growth. Now, we have to recognize that we have to serve the population that could be diverse all the time, especially in United States or even in Thailand here. We not just serve the people who like us or who think like us. We have to serve the diverse population. So you want to appreciate the cultural differences in communication and in treatment as expectation. For example, in Thailand, the monk cannot be touched by female. So if you are a female physician or female dentist and you have to have a close relationship to treat the male monk, so you have to ask for permission in certain time you may or may not be allowed. So for example, in certain cultures, the male may not be able to touch certain female. So you have to appreciate those cultural differences, communicate effectively, and not just rush into do a care, but also respect the cultures. You want to overcome the bias that build strong rapport, meaning that, we are come with our own bias, and the patient may come with his or her own bias. So therefore, by recognize that, you build a better communication and understanding. Um, you wanted to treat everyone. So regardless of who coming, I tell people all the time that regardless is the person going to be the king, the president, or the prime minister, or the member of parliament, or the senator, whoever's sitting in my chair, regardless of my family or my worst enemies, I would treat them with the best care I can give, because that is our profession, and that is demonstrate our professionalism. Now, of course, working as a team, you have to navigate the difficult conversation. And it's important to learn to manage difficult conversation and manage the conflict. And many times, patient may complain, oh, you didn't do, you complain about their care. You want to make sure that you demonstrate empathy and manage the patient, this satisfaction or patient complaint with empathy and clarity. And also, sometimes it's not just the patient that have a conflict with you, right? You can have a conflict with your assistant or your dental hygienist or your colleagues or your artist specialist. So you want to learn how to address the team disagreement constructively. And this is important in all teamworks. And you wanted to turn the conflict into a growth opportunity, meaning that if the patient come in and talk about, oh my God, I have to waiting so long in the chair, and you're running late. So you can take a look at that situation as something to improve your patient care in your practice. And why would you running late? Maybe you have to spread out your scheduling a little bit, or maybe, certain patient, maybe they cannot wait so long. And those are things that you can turn the conflict into the opportunities to fix things. And you want to think about having a patient-centered care. And this is something, as a practitioner, you focus so small, right? As a dentist, you focus so small on sometimes for me, a prosthodontic, we have a few micron. You want your crown to see perfectly. You want your occlusion to be touching perfectly, and this might be 100, 200 micron, which is a fraction of a millimeter. However, you want to think about that your care is the patient center, not procedure center. We build the relationship that root in trust. We not just focus on procedure, on the teeth alone. And this is something that very different from medicine. My wife's a physician, and I told her all the time that in the dentistry, we involve the patient in pretty much all decision and educate the patient all the way through, meaning that regardless the patient is just going to come to do a filling or endodontic therapy or orthodontic, or I do a lot of implant and full mouth reconstruction. I involve my patient in all of my decision process, and I educate the patient along the way, because we working together as a team. And consistently, you want to show empathy and communication, a good communication that's consistent. One of the things that I found, especially in my dental student, is when the patient walk into the chair, you automatically judge the patient of why did they don't take care of their teeth. Their teeth look so bad, and so many decades you don't see a dentist, and now the patient demand to be fixed right away. What we don't want to do as a practitioner is to judge them, because you don't know what that person have gone through in their life. I have a patient who have her mother that almost whole her almost for 30 years she's taking her mother at have debilitating illness that she won't have time to take care of herself. And as soon as her mother passed away, she came to me to fix her teeth. by that time she came to me, you know, we have to extract all her teeth and do all the implants and all those stuff. But I don't judge her because she came too late. But you know, people have things in life that may prohibit them from having dental care. Now, one of the things that we want to talk about also is teaching and mentoring soft skill and how do we cultivate these competencies, right? Number one, you want to be as a leader of your oral health team, you want to be a role model, and you have to have these reflective practice, meaning that you think about it in the daily basis that if you do your job properly in terms of soft skill, not just if your crown is fixed or dentures is look good. We in the dental school, we do role model, we do reflective practices, and we also do assimilation and communication training. And we integrate the ethical empathy leadership in our curriculum, meaning that when I build a case, for example, if I have exam, I teach a student on complete denture, for example, then I would talk about these patients have complex medical history, meaning maybe have kidney failure, may have to have dialysis. We talk about who would bring the patient to the dentist and how often that you need to see them, and how would we coordinate the schedule with their dialysis, kidney dialysis schedule, for example. And we talk about how to deal with patients with different personality and how to show empathy, and how to educate the patient, etc. So for future dentists, you want to blend design, technology, and humanity, because we not just, you know, we cannot just use them all. And I would say that the AI and robotic and all digital technology that we have elevate precision, but still empathy remain replaceable. Empathy still just as important, if not even more important than before you have a good technology. So as a dentist of tomorrow, most of you all would have to have clinically excellent and emotionally intelligence. And also we learn to build the trust in this digital age. So you want one of the things that I use to teach dental students all the time is a case reflection and use a real lesson in soft skill, meaning that after we see the patient, we go through the patient success story and we talk about how we did well. Did we demonstrate empathy? Did we demonstrate clarity on communication? And how is also we talk about it when things are going badly, and we talk about how would we do better in communication between the patient and us, as well as between the student and staff and the faculty. And we turn the moment of uh, that redefines success. Success is not just we fixing teeth, but how we fixing the patient, we care for the patient as a whole patient. So those are basically things that I want to talk about in the general for the soft skill. We're going to touch a little bit on the current literature on the soft skill. So unfortunately, we don't have a whole lot of paper on this. This is one of the rare one in BMC Medical Education that recently published this year. And the author called for greater collaboration with patient in designing soft skill curricula and to align the education content with the real need, meaning that we should consider bring in the patient. We are past the time when the soft skills are nice to have. They are an integral to competent humane dentistry, and these are being neglected in dental curriculum for a long time.
این
And this
میتینگ
is
تا کی قرار طول بکشه؟
oh, sorry, you are on your
Sorry, doctor, I will just mute. Doctor, can you unmute yourself, please?
Okay, yeah. Okay. Sorry, when I unmute myself, I have to go out of my presentation mode. Sorry about that.
Distraction.
Okay. Okay, so many dental school teach communication, teamwork, emotional reflectives, ethical and resilient domain, which is part of soft skill, are not fully developed or integrated into their curriculum. So this paper suggests that we want to clearly define soft skill like what we just did today and put it into the dentistry. And we need to train the educator to teach and assess this skill effectively, because in the past, we just watched the other people how to do it, right? Right now, my dental students just watch me how to do it, but really we need to effectively integrate this into all of the part of the curriculum. We talked about this already. And one of the things that important is we could use the patient and community as part of the education. So you want to use the patient, use community to help develop soft skill in the dental school. And the dental education must evolve from the very technically focused clinician to develop a patient, a holistic, well-rounded, a compassionate, thoughtful, and professional dentist. So this study looking at the systematic review that look at 1,449 record, and they choose 317 articles that met the criteria. Of course, these are not really directly look at all soft skill. These articles are grouped into 4 domains. They look at the dentist-patient relationship, cooperation and teamwork, work-life balance. They're looking at the clinical reasoning, and majority of this initiative is focused on the patient communication and term work, and less thing to do with emotional regulation, reflective thinking, ethic, or resilience. And you can see that they focus on the management of teamwork skill versus, internal soft skill. And we look at if you look at all these literature, you start to see the gap that there's lack of standard definition or framework of soft skill. I'm not claiming that I'm expert on this, but I'm just put whatever other people think soft skill are and whatever I think soft skill are. And there's not a whole lot of long-term study that look at a long-term impact on the student and on our patient. And there's a challenging in training of educator, the standardization of curriculum, and how to assess this skill. So now we know the current literature on a systematic review. How do we going to teach these in our dental education? And I wrote many of these, and if you look at my LinkedIn, this is one of the topic that I'm passionate about. And I look at the hard skill versus soft skill, and how do we really teach our dental education? In dental education, it's just like every field, we focus on the hard skill, which meaning the procedures, the material, the technique, the clinical competency. And these are things that are easy to teach, right? They look at how to use a scanner, how to do a crowd prep. But the soft skill, meaning the communication skill, the empathetic skill, the teamwork skill, adaptability skill, these are things that we are teaching them very shallowly, right? Because we just have you guys watch other people, we not really teach you guys. And interpersonal skill, emotional skill, cognitive ability, like how to listen to the patients, how to manage the patient fear, how to manage the patient and team conflict, and how to have critical thinking during all this process. Those are soft skills that we are not teaching a student really well. And why are these matter? Because communication builds trust. and we need to work as a team. And also, things are constantly changing. We need to learn how to be flexible and how to have a resilience in all the changes in the world. When you blink, there will be new AI come out, right? And also, we need to train the dental student that have a high professionalism, ethic, and empathy. And these should be the thing that guide our decision making on the day-to-day basis. And how do we teach this soft skill to our student? So we want to integrate into the clinical training. So for example, one of the things I do is after we have a clinical procedure, we do a debrief. The debrief are not only going through the technical process. I'll go to, for example, I have a student who walked in to see the patient for the first time making dentures, and he and the patient start to argue the whole entire procedures. So when at the end of the day, I asked him what's going on, and he tell me about how the patient will feel. The patient was angry. The patient was argumentative, blah, 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 blah. But let's stop right there and tell me how you feel when you see that patient. And what ended up happening was the patient are, number one, a very difficult, angry patient who have been through a whole lot of failed dentures, and now he see a new graduate dentist who gonna make her denture, and she just doesn't trust him, and at the same time he afraid of her, right? So the practitioner himself have an anxiety. So this has become a teaching moment that is not just how the patient feel, but how we feel about the situation. And we talk about how to communicate better and how to deal with his emotional stress and anxiety. Now, we also do a lot of simulated patient encounter. And this is we have a simulating, basically we have an actor, and we have the actor talk to student about certain thing, and then we have a role play, standardized patient, and these can be done with the real patient. We also use virtual reality, and we record the conversation between the student and the actor or the avatar. And then we bring the student afterward, and we talk about how well they did. We record their conversation, and then we point it out to the student. Oh, you didn't look at the patient in the eye, or you didn't pause and let the patient explain themselves clearly. You don't have an open-ended question, and you don't allow time for patient to answer questions, blah, blah, blah stuff. And these are things that we can do really well on the daily basis. Okay, so interprofessional education. So we also paired, because we need to learn with the teamwork and as multiple specialty. So we pair our student with the hygienist, with the physician, MD student, nursing student, public health student, and to develop the project together so they learn how to develop communication skill and teamwork skill. One of the important things that I always tell my student is reflection, either reflective writing on the daily basis or journaling are very important. And this important in all skill, right? Because when you pause and you reflect on what you just did, and we not just talk about technical skill in this case, we talk about if your decision to treat this patient is ethical. What is the emotional experience that you have? How was the patient interaction go? And how do you feel throughout the process? And by reflection, you learn something, right? By reflecting for all of these things, you develop a better clinician. Now, the other thing that I often emphasize is mentorship and modeling. And this is from the faculty to student, if you're a dentist, from the dentist to the staff. And it's important that the faculty must model this soft skill openly, meaning that when the student see you treat the patient, for example, you debrief them, not just lecture, not just like this lecture about it, but you develop the living example. And I do this a lot with my pre-dent student, because I tell them, like, you see, this is how I explain the patient. I don't use any jargon, but I use the patient language to explain the procedure that I'm going to do. I touch them very compassionately. I let them speak, and I have an open-ended question. And I'm always leaving with, if there anything else I can explain it to you, or anything else I can help you with. And that lead into the communication with empathy, right? So you wanted to explain things very clearly, systematically, because you don't want to miss things. You want to listen with open communication, and this would reduce anxiety. And the empathy and compassion usually comfort the patient and ease the dental anxiety and fear. Now, let's talk a little bit about critical thinking in teamwork and professionalism. So we don't work alone. No one is an island, right? So the critical thinking and problem solving need to be analyzed and decide and innovate as a collaborative and teamwork manner. So we need to be able to work effectively in a team with professionalism and ethic. And we need to think about if what we do is the right thing to do, we have a value and a standard. And we talk about it that the dentist is a team leader, and things will change constantly. So you want to be adaptable and resilient, and make sure that you have flexibility and in handling pressures. And remember, when you are a leader, you need to guide, you need to motivate, and you need to inspire. One of the things as a dentist you have to do really well is to do a time management and be efficient. Especially, I have a many time to do same day crown. Many time I do immediate full arch implant restoration with full arch immediate provisionalization. So you have to have a good time management. And these are things that are lifelong learning. I'm still learning every day, and you all would be continuing to learn this every day. Now, the last few things I would talk about the burndowns, and then I would touch on technology, and I would open the forum. Hopefully we have maybe 10, 15 minutes at the end to answer a question. So burnout is something that important, and I think that the mental health and self-care in dentistry are something that we often forget about it, right? Because we don't want to talk about it. But the burnout in dental community are real, and it's getting worse, and it affects everyone from dental student, resident, staff, and faculty. And we need to be able to identify it first, right? Because when you have a problem, the first thing you do, you want to have an external and internal awareness and recognition of burnout, not just from ourselves and for others, and also raise the social awareness about burnout. We wanted to develop, we develop the dental curriculum, we want to keep this in mind, so that we develop the curriculum program that incorporate mental health and self-care in mind. And we want to manage this because it will happen. So you want to develop a protocol or procedure that dealing with the mental health and burnout in dental student, in dental school, in your practice. And you want to not just identify, prevent, manage. For me, I think it's also important to build a culture of resiliency, meaning that you committed to the continuous improvement, because we all will have a bad day, and we all will have stress, and we all at some point will have burnout. So you want to commit it to continuous improvement process on mental health awareness, self-care, and support both care and resilience for the system, and as well as for ourselves. So preventing for burnout, the best way to prevent, I would say, burnout is just like, it's just like if you're gonna go to, if you are athletic or something, you wanted to make sure that you have a good habit for your physical and mental health, meaning you want to sleep well and eat well, right? Because your body and your mind are connected. I do a lot of reflective journaling. Reflective journaling usually help clear your head, give you a reflection, and sometimes when you put things on paper, it just feel better. You want to develop a good friendship at work. You want to have someone who gets it, right? And when you find someone who gets it, it changes everything. You need to have a mentor who can guide you, advocate for you, and remind you how special you are. And you want to have certain boundary, because when you just think about work or dentistry all the time, you have, everybody have limits. So you want to create some kind of boundary. And then take a break without guilt. So everybody need a break, everybody need to rest, and you don't need to earn it. And small daily pause, meaning that, go for a walk, deep breathing, music, or resilient, or do something else. Small daily pauses usually help. And for me, mindfulness is very important. Meditation, yoga, Tai Chi, pray, or just work out. Those are things that you can use for prevent your burnout. There's a study on the burnout with dental student published recently in the Journal of Oral and Maxillofacial Pathology. Um, and they look at the prevalence of burnout among dental students and its association with social demographic factors. And they look at the questionnaire, involved 200 dental students, and look into the symptom of burnout related to burnout, stress, anxiety, and depression. And they found that about 28% of the student report high stress level, and the student from middle class background consists of 77% experience a significant stress. And the female dental student report higher stress compared to their male counterpart, about over half of the female student. So you recognize that these are self-reported, right? These are questionnaire reported. So the reliability and comparability might be different, meaning that you may have more or less of this because this is a self-report. Some people might not report it by themselves. And it's also a single institution that look at this. And the study basically look at the prevalence without looking at the longitudinal. It's a cross-sectional study. It have to look at the cause and potential intervention. In anyhow, the study suggests that the burnout it have multi-facet issue, and it can hinder development of the competent and compassionate dental professionals, and it's emphasized that we need to have early recognition and proactive measures. And as an institution or a dental school, we should consider implementing mental health support, have accessible counseling services and stress management workshop, and we need to incorporate wellness, resilient training into dental education. And we need more study, and obviously we need some kind of standardization tool for better understanding and address burnout in dental community. What about the faculty? The faculty basically also, faculty have a critical role in shaping next generation of dentists, clinician, researcher, or educator. However, the demanding of academic dentistry, you have to balance teaching, patient care, research, administrative duty, mentoring student, can lead to burnout and a state of emotional and physical and mental exhaustion caused by prolonged stress. And you can see that these are emotional symptoms, meaning feeling drained or emotionally exhausted after work. I'm sure all your faculty have this experience. We lost motivation or enthusiasm or passionate about our profession or our job, increased irritability, detachment, or on the other hand, some people might get more grumpy, some people might get a detachment from work or from student, and overwhelming stress, anxiety, or even hopelessness about the institutional changes. We also have a physical symptoms such as chronic fatigue, exhaustion, even after you rest, frequent headaches, muscle ache, body aching, stress-related illness, disruptive sleeping pattern, loss or change appetite, increased susceptibilities for certain illness due to prolonged stress. But these are things that you can notice from yourself. And for the faculty part, the bigger picture is the burnout when you have a reduction of productivity in teaching, research, or clinical responsibility, and you start to have procrastination or avoidance in academic duty. Some faculty may withdraw from their professional activity, colleagues, or even student, and increase relying on stimulant. For example, I drink coffee all the time, or certain people might have alcohol to cope or abuse. So if the burnout in the faculty are left unchecked, it not just affect that one person, but it also compromise the entire dental education system and the student learning outcome. And the faculty who disengage or overwhelm cannot effectively inspire, educate, or mentor dental student. So we need to have the institute support. The faculty should have encouraged to set a clear boundary between work and personal life. We should have a regular break, self-care, and hobby for all faculty. And we should promote the flexibility, for example, flexible schedule when the faculty start to get overwhelmed. In terms of self-care and resilience, we need to have a mental health support. We have to develop, for example, mindfulness stress reduction program, or the culture, the collaboration over isolation, foster supportive, healthier working environment. So for the dental faculty, it requires systemic change, and we need the institutional commitment. They cannot just do by themselves. For ourselves, we need to recognize the early symptom and foster the workplace so that the faculty well-being is prioritized. So let's touch a little bit on AI technology. So I work with a company called Gain AI Dental, and you can see this is my friend, Dr. Tanner Flack Hardy, and I'm not gonna play. You're not gonna hear his voice, but I'm gonna talk over him. So basically, he have this app on his phone, and the phone basically record what he does. And if you incorporate the phone with the video, we can actually use it to record the draft of the note and also give the patient communication insight. So basically, you just talk to the patient, don't have to worry about memorize anything, and the AI basically produce the note and give a note for you. And you can do a sub note, for example, this one, the sub note, and it populated a note for you. Not just the note, it also gives you a subtle prompt of how to effectively give a case presentation, and also have the sentiment analysis, meaning identify patient question and hesitation. And also, it also provide the post-visit data for the team to calibrate and train. It can capture the audio, recognize different people who speak, and then it transforms the raw conversation into the clinical structures. For example, the subnode using a language model. It analyzes the phrase, the tone. It flags if you have empathy, clarity, and open question. And it's in real time during the visit. So it gave you a give you a real-time clue during the visit. It also give you a post-visit note. It also be something that a friendly draft, and it give you a coach and a cue afterward, meaning this would be something you can give the patient signet, PSI. It reduced the it also gives you a human into the loop review, and it also audit and encrypted and all kind of stuff. So I'm gonna close so that we have some time for questions. So soft skill is beyond technical skill, right? Success in dentistry is depend not only on clinical expertise, but also on interpersonal and professional quality. And the core competency include communication, empathy, teamwork, professionalism, critical thinking, adaptability, leadership, time management, and lifelong learning. It have impact on patient, it build trust, reduce anxiety, enhance satisfaction, and strengthen the patient-dentist relationship. It impact on the practice by improve teamwork, foster positive working environment, and support ethical, effective care delivery. It impact on the career. It would differentiate you as a dentist. It would drive leadership potential and support continual growth in the rapidly evolving dental field. So a take-home message is soft skills are not extra. They are essential skills that empower dentists to deliver compassionate care, achieve clinical excellence, and thrive in their career. It's about a balanced outcome, meaning that when we teach both how to do and how to be, we must produce not only the clinical competent dentist, but clinician who listen, who lead, who adapt, and heal. And excellent in clinical hard skill must come with excellent in clinical soft skill. Because in the end, dentistry is not just about the drill, but it's about the relationship. I'm thanking for your time. I give you again my LinkedIn and my Instagram, and you have my email here. If you if you don't want to answer the question right now, I'm going to stop here and stop sharing screen, and I will answer the question if you have.
Thank you, Doctor. Thank you for insightful and inspiring presentation. And guys, if you have question, you can write it down in our chat box. And Doctor, I went through a question, like what strategies you use to balance the boundaries and the professionalism in your team, because there's a saying which is says like you cannot fire your friend. So when a conflict happens, how do you manage such a scenario?
That is a great question. And you say that you cannot fire your friend. I did fire my friend before, and we are still friends. I fired my friend from the job because he worked for me, but we are still friends outside work. Uh, but what I'm saying is you have to have a boundaries sometimes, meaning that people say different things, right? You cannot be friend with your coworker, or you cannot be friend with your boss, or you cannot be friend with your employee. I think it's the opposite, right? So we could be friends, and we have to have an open, honest conversation. Number one, I think we have to have an open, honest conversation with people most of the time. And it's not like you have to tell your life story to people. I would tell them that I would always give everybody the same message, but different level, right? Because if I tell the dental student, I might sell the lowest level. If I told the dean, I might have to give them the whole detail. But they're all going to have the same message to me. So number one, you need to be an open communicator and also have a trustworthy word. Number two is you have to have boundary, meaning that if your friend did such a bad thing at work, meaning my friend, for example, doesn't come to work on time, he doesn't finish the stuff that he was promised me that he would get it done. And we have an improvement plan. We go through multiple rounds of things that we could improve. At the end, I just tell him like, hey, this is not the job for you. And I love you as much as I loved you yesterday, but you cannot work for me anymore because things that we agree on, you could not do. And we can hang out still outside work, but you cannot work for me anymore. And you have to develop that. We have some, we have boundary, but we also have friendship.
Mhm. So it's more about like effective communication.
Right.
Yeah. So, Sufia Tawakulian, could you please explain a little about managing balance between honesty and empathy? Because during consultation, not giving false hopes to the patient and expressing our honest professional opinion might come off and be considered as being insensitive and lack of compassion.
That is an excellent question. And we have to deal with it all the time. And we, fortunately, the worst thing that could, we don't have a whole lot of life and death situation in dentistry, but we do sometimes. And in certain people, when you walk in and you tell the patient that you have to lose, he or she have to lose all their teeth or part of their mouth or part of their face, or certain time we might have to tell them that it debilitated disease that they might die, right? So there are those things. So I would say, number one, that you want to be honest. Number two, honesty doesn't mean tell the patient everything, right? There's a timing about when to tell the patient and how to tell the patient. And I would say that number one, you need to focus on develop a good relationship with the patient, right? Number two, you have to learn empathy. And empathy are not something that you read in the book and you learn. I'm still learning to be more empathetic, right? And I've been practicing for most of my life, really, right? Over 30 years, right? So I think you have to learn, number one, to put yourself in the patient's shoes, and meaning that you want to be able to really, really feel the person pain and suffering and anxiety. And unless you put yourself into the person's shoes, you're not going to be able to give an empathetic, honest answer to the problem the patient have, right? So number one, work on your empathy. Number two, then you have to develop a communication skill, meaning that how, when, and why, and where to tell the patient, right? So let's say, I mean, sometimes we do HIV tested and we said the patient have HIV, and how do we gonna tell the patient that? Right? Because that might change their whole life situation, and that might change if they have family, that might change their whole spouse issue too. And then maybe the spouse doesn't know, and then they go into a whole different issues. Then what you want is certain thing they may have to be a discrete room. You might not want to talk about the HIV positive thing in the middle of the clinic floor in the dental student clinic that have like hundreds of students and patients and stuff there. So you might want to take the patient a certain place and then talk to the patient privately and gain the patient trust first before you tell the patient something. So I think develop empathy, develop the communication skill, how to tell the patient. And the last thing also is learn to get the patient feedback. You only get better when you get a feedback, and you want to ask the patient honestly about how well you communicate with them and how well you do and how they feel about you, and not just you, about your staff, about your dental school, about your dental clinic. And when you get the feedback, you become better, right? So develop empathy, develop your communication skill, and get your feedback. And the last thing I would say that you do, I'm a big opponent of supportive of reflective writing. So every day I write a little bit of something and how I feel about the situation that happened. And sometimes I debrief the reflection with my team. Great question.
That's great. Another question about being empathetic. How do you stay empathetic after seeing 30 to 40 patients a day and still avoid burnout? And yeah, like I got the kind of same question, like because being empathetic, it's most about having, if we have our own practice, if we have our own clinic, once we are working in other clinics and they are expecting you to visit some amount of patients like 30 to 40, how we should avoid falling behind the schedule.
So that is a great question. Like we talk about burnout, right? We talk about burnout, recognizing burnout. So whoever asking me already have the burnout. Whoever asked me. So whoever asked me need to think about number one. You think you have to put your mask on yourself first, right? When you go on a plane, you have to put your oxygen mask on yourself before you put the oxygen mask on the person right next to you.
Mhm.
And the reason is you cannot be a good practitioner unless you have a healthy mind and you have a healthy self-care habit. Now, if you think that you could not do what you were asking to do, perhaps that was not the environment you don't want to be. And I could say this because I'm just quit my job, so I'm at the state that I can do whatever I want now. But for you all, maybe that might not be an option, right? If I'm a dental student, I just have to do whatever I was told. Now then you have to things, if you look at things first, like if these things can be fixed, if it cannot be fixed, how else can we do better? Meaning that if we're going to have to see these 10 patients a day, and how can we stay empathetic? Meaning that whatever how many patients you see, you have to think about you might need to take a 5-minute break every 5 patients or so, maybe. Or maybe you have to develop your self mechanism on how to have a self-care and self-awareness of when you start to get burnout. Meaning that when you start to get irritable easily with somebody say something, or you just annoy, or you just start to withdraw and you start to stop listening to people. And those are the number one, recognize what happened inside you. Number two, figured out what is the best way to deal with it. And everybody different, right? I would take a 5-minute walk when I don't have time for lunch, then, or I don't even have time for walk. I would give myself maybe 2-3 minutes of sitting down and just relax and do a couple breathing exercise. Or I would have an extra cup of, cappuccino or something like that. So those are things that you could do, and you can think about how to deal with the situation, and then you can work on being more empathetic for the last patient you have during the day. I think it's a self-care problem.
Thank you, doctor. Thank you for your explaining. I think it covered everything. Anyone else has a question? So for the last question, I would go for what personal or daily habits would you recommend us?
So
A long,
I have
long answer
I
question.
love it. That's also an excellent question. So there are, I think your body and your mind are connected, right? So there's a physical health and there's a mental health. There's also a spiritual health. And I'm not telling you to believe anything, right? I'm not trying to convert anything to any religions. I think all religions are great. So number one, you want to take care of your body, meaning that you want to sleep. I need to sleep 5 hours. Some people need to sleep 8 hours, or whatever, how many hours you sleep. You have to have a good sleeping habit. You have to have a good sleeping routine, and you have to have a good eating habit, and you have to have a good exercise habit. And those are things that you must do, because physical health and mental health are related, right? The second thing is the mental health. Mental health meaning that you want to learn how to recognize your emotional state, right? And there's multiple way to do it. To me, what I do was I tie my emotional health, emotional changes with my physical changes, meaning that when I get angry, I feel the something in my chest, like feel like I'm suffocating. When I'm sad, I feel like my heart, somebody's stabbing my heart I have something stabbing in my heart. When I'm tired, I uh, meaning when I'm exhausted, I would have like a blurriness in my head and stuff. So I'm just giving example. So recognize your emotional issue with your tied to physical, because your body and your mind are connected. And in my mind, your body know your emotion before you recognize intellectually. Because remember, even lowest level of animal have emotion. And the human have this frontal lobe that just developed the last few million years. But the lower animal have the limbic system, which is way deeper in your brain, are developed way before the frontal cortex. And the limbic system are in the inside your brain that regulate emotion that connect to your body. So if you connected your body with your emotional state, when you feel those things in your body, you recognize those as a clue that you start to have a burnout and you have to deal with those things, right? So these are mental health part component of it. And you can deal with them whatever way you want to, right? The last thing is the spiritual health. And I'm not talk about what I'm doing is I would wake up. As soon as I wake up, I use the bathroom and then I sit and meditate for about 30-40 minutes to an hour. And you can do a prayer, you can do whatever, right? So I do it twice a day, meaning that I doing as soon as I wake up, I do it before I go to bed, and I have my routine of I'm going to bed, um, meaning that I would be with whoever or whatever you believe that bigger than yourself. And that would my routine of my physical health, my mental health, and my spiritual health. And you can change to whatever the daily routine you want, a weekly routine you want. My suggestion is to have your habit for a daily routine, so make it easier for you to keep up with. Oh, one last thing is also I have a little journal that I write. So I'm writing my dream, my feeling during the day, my praying meditation experience. So I use the reflective writing as my self-expression. And sometimes I take some of those to write in my LinkedIn and stuff. But there's a lot of things that I'm just writing, didn't share with anybody.
Okay, I think that brings us to the end of today's session, and I would like to extend our gratitudes to you, Doctor, as on behalf of all participants and ADSU. And thank you for your time. Thank you for sharing your knowledge, your experience, and your insights with us. Thank you. If any last words you would like to say to students?
So I just wanted to thank Efren for arranging this, and we get to know each other really well, even though we never met in person, but I feel like I know him for a long time.
Thank you so much.
I'm very impressed with him, and I'm impressed with your guy. And I think this is by you guys showing interest in this topic, you are far more advanced than hundreds and thousands of dental school around the world. Majority of dental school doesn't even talk about this at all. And I think it's important for us to put this in perspective, and is something that you need to be able to use this throughout your career and throughout your life, really. But finally, I want to thank you all for opportunity, and have the good rest of the year, and we see you again next time.
Thank you so much, Doctor. Thank you. We are looking forward to see you again. Thank you. Thank you for your kind words. Thank you.
Appreciate it. Appreciate your time.
Thank
Have a
you.
good night, everyone.
Good night, Doctor.